This product contains a combination of a mineral, iron, and 3 vitamins, vitamin C, vitamin B12, and folic acid. It is used to treat or prevent a lack of these nutrients which may occur in certain health conditions such as anemia, pregnancy, poor diet, or surgery recovery. Iron is important for producing red blood cells, vitamin C helps the body absorb iron, vitamin B12 is important for blood, cells, and nerves, and folic acid is needed to form healthy cells, especially red blood cells. Women of childbearing age should maintain adequate amounts of folic acid either through diet or supplements to prevent spinal cord birth defects. The recommended daily dosage and optimal timing for taking Icar-C Plus is: when taking Icar-C Plus, it's important to read all the directions on the product package. This medication is usually taken by mouth once daily, preferably on an empty stomach, 1 hour before or 2 hours after meals. If you experience stomach upset, you can take this medication with food, but avoid antacids, dairy products, tea, or coffee within 2 hours before or after taking it, as they may decrease its effectiveness. Be sure to take Icar-C Plus with a full glass of water, unless otherwise directed by your doctor, and avoid lying down for at least 10 minutes after taking it. If you are using the liquid form, use a special measuring device to carefully measure the dose. To prevent staining the teeth, you can mix the dose in a glass of water or juice and drink it through a straw. For those taking extended-release capsules, swallow them whole and do not crush or chew them to avoid the risk of side effects. It is important to use this medication regularly in order to get the most benefit from it, so try to take it at the same time each day. Some common side effects of Icar-C Plus may include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, it's important to consult your doctor or pharmacist. Iron in Icar-C Plus may cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, it means that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to Icar-C Plus may occur. Seek medical help immediately if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience any other effects not mentioned, it's important to contact your doctor or pharmacist. In the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years. Keep this product out of reach of children. If overdose does occur, get medical help right away or call a poison control center. It's important to be aware of the potential risks and to keep Icar-C Plus out of reach of children at all times. If, by any chance, an overdose does occur, it's crucial to seek medical assistance immediately or contact a poison control center. Before starting Icar-C Plus, make sure to inform your doctor if you have any allergies or if you are allergic to any of its ingredients. It's important to also let them know about your medical history, especially if you have certain metabolic disorders, alcohol use/abuse, stomach/intestinal problems, or vitamin B12 deficiency. If you are planning to have surgery, it's important to inform your doctor about all the medications and herbal products you are currently using. If you are pregnant, Icar-C Plus should only be used when clearly needed, so make sure to discuss the risks and benefits with your doctor. Additionally, if you are breastfeeding, consult your doctor before taking this medication. It's important to be aware of potential drug interactions with Icar-C Plus. Certain anti-seizure drugs, like phenytoin, may interact with this medication. Additionally, Icar-C Plus can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate your doses of these medications as far as possible from your doses of Icar-C Plus. Make sure to consult with your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. Also, be aware that this medication may interfere with certain lab tests, potentially causing false results. It's important to inform lab personnel and all your doctors that you are using Icar-C Plus. If someone has taken too much Icar-C Plus and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency medical help right away. In the United States, you can contact your local poison control center at 1-800-222-1222. In Canada, reach out to a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed Icar-C Plus for you, it's important not to share it with others. While taking this product, you may need to undergo lab and/or medical tests, such as a complete blood count and checking your vitamin B12 levels. Make sure to keep all medical and lab appointments and consult your doctor for more details. There are various iron supplement products available, some with a prescription and some without. Some brands may also contain ingredients like succinic acid or docusate, which can help your body absorb more iron or decrease side effects. If you have any questions about available iron supplements or their ingredients, it's best to consult your doctor or pharmacist. Remember that this medication is not a replacement for a balanced diet. It's important to maintain a well-balanced diet that includes foods rich in iron, such as beans, nuts, asparagus, oatmeal, red meat, dried peaches, and pork liver. B vitamins, including folic acid, are naturally found in leafy greens, other vegetables, meat, fish, poultry, and enriched breads and cereals. If you happen to forget to take a dose of Icar-C Plus, take it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed one and take the next dose at your regular time. Avoid taking a double dose to make up for the missed one. When it comes to storing Icar-C Plus, it's important to follow the specific instructions on the product package or ask your pharmacist. Make sure to keep it out of reach of children and pets. And when it comes to getting rid of the medication, don't flush it down the toilet or pour it into a drain unless you're told to do so. Instead, properly dispose of it when it's expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.